The topic of probiotics when it comes to SIBO, or small intestine bacterial overgrowth, is a little bit of a controversial topic. You can certainly find folks online or in professional atmospheres saying that probiotics are an absolutely forbidden thing to work with if a person has small intestine bacterial overgrowth. And then you can look at the research literature where the majority of studies that have looked at probiotic use in folks with a SIBO diagnosis actually showed, on average, a mild benefit to being on them. What I've found in my clinical experience is that probiotics and SIBO tend to have a fairly uneventful relationship. Granted, there are some patients who definitely flare like crazy going on probiotics, presumably from the prebiotics that are in the probiotic that are ultimately feeding the SIBO inadvertently. But most of the patients I've worked with who are working with probiotics and they have a SIBO diagnosis, they don't really notice a difference one way or the other. It doesn't seem to help them, doesn't seem to harm them or hinder them, and I found them to be relatively net neutral. So in my experience, I don't really talk to my patients who are dealing with SIBO about probiotics a whole lot unless they happen to be on an antibiotic for treating some other type of infection while we're dealing with SIBO or something to that effect. And if they say, hey, I'm on a probiotic and it's helping me, great, keep it up. If it's not making much of a difference, then maybe we just drop it because it's not really making much of a difference.